Ellie Fund convened a panel of top-tier medical experts and community leaders who engaged in thoughtful discussion about equity and access to life-saving breast cancer treatment here in Massachusetts in an effort to tackle the serious matter of disparities that too many encounter in accessing breast cancer treatment and non-medical support services. Since the emergence of COVID, Ellie Fund has been laser-focused on disparities and social determinants of health to breast cancer care and treatment via its Equitable Pathways to Breast Cancer Care initiative. These experts are deeply concerned about those who continue to delay screening and will beat the cost of shortening lives from breast cancer and other cancers. All agree the standard for integrated Ellie Fund services must be early and often. In 2022, the American Cancer Society estimates 6,710 new diagnoses of breast cancer in Massachusetts.
Over 25 years, we have served probably 15,000 patients, and every single year we serve maybe 900 to 1,000. So we were so proud of that, but we all looked at each other and we were like, okay, what about the other 6,000 people that have no idea who we are, that are out there being treated for breast cancer and don't have Ellie Fund support? How are we going to find them? Who are they?
Is that a matter of the fact that they're not aware of it? Is that a matter of the fact that maybe they don't have access to those services?
Most breast cancer patients are women. Women are very busy. They're moms, they're working. And we're saying, you've got to come in, you have to have surgery, you might need chemotherapy, come back and forth, get labs, get scans, radiation every day. They can't imagine how they can take the time out logistically or financially to get the care that they need.
Black and Hispanic women are more than twice as likely not to see a doctor than white women due to cost of care.
There is a disconnect in care. Once the diagnosis happens, that we run into all the barriers to care, the transportation.
If I need to be in a treatment protocol, do I have an issue with regard to having my children taken care of? Do I have an issue in regard to the choices I may have to make between the cost of the treatment and the cost of maintaining my household?
We talk about things that are too good to be true, groceries, childcare. That's trying to make people whole.
12 years after being diagnosed with breast cancer, women had between $1,000 and $3,300 of out-of-pocket medical care costs per year.
Once I had a breast cancer diagnosis, I was not offered the services, so I told them, I know there's an Ellie Fund organization and I would like to receive their services.
And when we talk about preventive care, which we typically talk about in the context of what can I do now to prevent a problem later?
As physicians or nurses or community health workers, we need others to help us, especially in the climate that we're in today. For the Ellie Fund to step up and say, I understand that this is an integral component of a woman's life. It's indispensable.
Breastcancer.org surveyed over 600 people. About 30% reported they chose or considered delaying or changing their own treatment plans due to concerns about contracting COVID-19.
I'm waiting for the fog of COVID-19, which is what I think the last 2 years has been, to start to dissipate so that we can get back to focusing on these serious medical conditions that, quite frankly, has Black and brown people living shorter lives.
So where the Ellie Fund has stepped in is to say, you know what, we'll help you with the transportation, we'll help you with the childcare, we'll help you be whole.
For more information about Ellie Fund services, or if you want to help, go to www.elliefund.org.